It gives me great delight to introduce my guest, Samantha Kane, who I've known and worked with on the client side for interim management for several years. Samantha has spent the majority of her career working in the public and third sector, holding several senior roles in health and social care, and most recently in primary and community care. Prior to becoming the Chief Executive of Operose Health in February 2024, Samantha has spent several years working within the Chief People Officer position and was a trustee of I Am Road Smart, a road safety charity. Her motivation centres around improving health and care outcomes for patients and communities, and as a chartered fellow of the CIPD, she's equally passionate about people. I'm thrilled Samantha has taken time out of her very busy diary to talk to me about her journey from Chief People Officer to CEO. Wonderful to have you with us today, Samantha. Thank you so much for taking the time to come and see us. So, since taking over the reins as CEO of Operose Health earlier this year, in a market of healthcare which is highly competitive, highly regulated and forever challenged, although there's some incredible stories of success, as we know, talk me through your career to date, spanning from what I understand from the public sector and a mix to obviously now the independent space. So please share with us what your journey has been.
Well, thank you. So I started life in HR roles, and I've probably done the full range of HR roles from HR administrator all the way through to Chief People Officer prior to my appointment as Chief Executive Officer of Operose Health. I've always loved people. I've always had a real passion and energy for people, and that's what's always drawn me to HR roles, and equally that passion extends to public service delivery. There's always just been something pretty special about it for me. I've always really wanted to be able to make a difference. That's what drives me and gets me out of bed in the morning. So I've done quite a range of public services, again, predominantly in HR roles, from police, prison service, local authority, public health, education, welfare, and then settled quite firmly within health and social care. So again, a range of different services, sexual health, mental health, community service provision, and ultimately ending up here at Operose Health. We're the UK's largest provider of primary care services. We run around 65 GP practices in England, with London as a key area of focus, but also scattered around the country. And yeah, day in, day out, we're delivering phenomenal care for our patients, our ICB commissioners and our communities. And I love it.
Wonderful. That's exactly what I had hoped to hear. Tell me more about the business, though. What does it do in terms of that primary and community care? How does it reach those patients? What are the key services that it represents?
Yeah, so in primary care, we run a range of services. So we run GP practices, we run urgent care centres and walk-in centres and GP hubs. So just as you would imagine going to your GP now, we run those services. We're an independent provider of NHS services.
Right.
And so employing doctors, nurses, receptionists, admin, healthcare assistants. So doing exactly what the NHS does, but just as an independent partner to it. We work with around 14 ICBs.
Wow.
And deliver really good primary care. So with a real focus on our people, providing good access, good outcomes for our communities, and improving patient experience.
And in terms of the population, I mean, geographically, that's going to be quite dispersed, but on average, how many patients do you think as a business you're actually seeing annually? And of course, it's getting busier and busier, and soon to be even more, I suspect.
It is. It's a super busy time for primary care, and actually it's really nice to see that the attention is where it should be across health and care. Primary care is the gateway for most people day to day in terms of how they access the NHS.
Right.
But we've got 630,000 patients on our list, and as you said, growing every day, and we have ambition to reach that to 1 million. So that's a huge amount of growth. But again, we believe what we deliver the market is super special. And so we'd like to extend our reach as much as we could.
No, amazing. Absolutely amazing. Which brings me on to the road of becoming, obviously, a CEO. And from what I understood from a previous conversation with you is that it was something that you hadn't thought of before, but it was presented to you by the board, which obviously is the biggest compliment one could ever receive. So thinking about that, in real life, it's very different to a CPO role. Tell me about, your approach to that leadership consideration and what you actually had planned for the first 100 days or so. how did you sort of manage that in your thoughts? Because as I said, it wasn't something that you were thinking about at the time.
I think with all these things, timing's always key, isn't it? So I was recently back from maternity leave after baby number 2. I think if you could draw your plan for your career, I was kind of looking forward to a little bit of an easy transition back to the workplace. But I always think also the best opportunities are probably the ones you've not necessarily planned out.
Totally agree.
And yeah, time, these things don't always arrive when you would have planned for them. So with a little bit of persuasion from a very supportive board and a very supportive chairman, the opportunity arose to lead this organisation. And it was probably a little bit of an opportunity too hard to shy away from and turn down. So that's how it arrived. And the first 100 days, I don't know whether it's too different from a CPO role, I think. I've often described it as a little bit of a CPO role, but with steroids.
Right, okay.
So I think if you think about the things that we talk about as CPOs, we talk about the importance of people, the importance of creating the right environment for people to thrive. We talk about providing clarity. And so that's what I've been spending my first 100 days on. I've been out, I've got to know the business, I've met our amazing people, I've seen our fantastic clinical delivery, I've met our commissioners, I've asked loads of questions. And I've surrounded myself with a brilliant team. So, job number 1 was make sure I've got the right people in the right place doing the right things. Job number 2 was thinking about, well, actually, who are we as an organisation? Where are we going? What do we want to be? What do we want to be known for? And so we did a big piece of work on, what's our strategy? How do we communicate that to the business, to our key stakeholders? How are we going to grow? What's going to hold us back? And so that was the first focus, I think, for the first 100 days. And where am I now? Well, month 9, and I've got an organisation super excited to continue to deliver the great care.
Yeah.
Our performance is really strong. Our feedback from our commissioners is really positive. And what a time for primary care. New health secretary, huge amount of focus on primary care. And again, I believe that we're one of the players that will help turn the sector around.
Which is absolutely fantastic. Again, as I say, I mean, right now it's absolutely paramount in so many different areas or provision of health care that is needing support, is needing improvement, is, got a lot of challenge associated with it. And also when you become a CEO, obviously the stakeholder groups are completely different as well. So navigating around, who are the key individuals to get to know. You mentioned the ICBs before as well as actually having that flair of knowing the values and the proposition and the cultural element of being, very strong in HR throughout your career as well. It's not an easy role for sure. And it is, from my experience sitting this side of the table, that transition from CPO to CEO in healthcare is quite rare. And I've seen extremely qualified and engaging individuals who have successfully gone over to lead an organization, which is fantastic. But it's about that sort of learning. So did you, within your peer group, and obviously other perhaps CEOs as well, did you learn from them? Did you sort of seek counsel on what it might look like with this new journey of yours, this new transition?
Yeah, so firstly, I think more CPOs should do it, number 1. I'm absolutely in
I'm
that
all
camp.
for that.
Secondly, of course, I mean, every day's a learning day, right? And so the day that you stop learning and think you know all the answers is, a worrying day. So I am a massive believer in surrounding yourself by amazing people, if only to challenge your own thinking, diversity of thought. So again, I'm supported by a fantastic, ambitious and driven supportive board.
Great.
I have a great chairman. I have a great network of, as you said, fellow CPOs. I know I've reached out to other chief execs in the sector. And so again, it's just about talking, learning, asking lots of questions, listening to lots of different viewpoints. But that's, again, for me, it's part of the fun, and it's part of why I've always been a people person, I think.
And I can certainly see the energy in you. So that is absolutely needed. And when you take over the reins as a CEO, and you are in your 8th or 9th month or so, I'm going out and meeting multiple stakeholder groups, different practices. You need that sort of flair and that energy. And so that is totally demonstrated in front of me right now, which is wonderful to see because it's passion as well, isn't it? Samantha, you mentioned earlier about primary care being, this is the time to be addressing so many different areas within that portfolio. Talk to me a little bit more about that, sort of like the here and now and what potentially could be in the very near future.
Yeah, so as we said, it's actually really nice, I think, for the sector to be focusing on primary care at the moment. I think historically media and the conversation's been around hospitals and admissions and those pressures. But the primary care really is the front door for people and the thing that most people access, the majority of the time.
It's where it starts.
It's where it starts.
Yep.
And, we know that there are not enough appointments. We know that people have to wait too long. We know that the workforce are incredibly tired and there's not enough of them. And we know that we're not attracting and retaining enough people. We work as well as an organisation often with GP partners who have just they want to continue to do what they're doing, but they've just got to the end of their ability to deal with all the pressures and they feel again quite vulnerable and quite lonely. And so we work with them and transition them under our organisation to support them, to enable them to do the things that they are brilliant at, great patient care. And we can kind of support them with all the other kind of more business and commercial aspects of running what effectively is mini businesses. So what are the challenges? Well, we need to find ways of incentivising, motivating and retaining the workforce again. We need to find more ways, unique ways, innovative ways, use more digital tools to be able to improve access. And that might not be just access to a GP, that might be access to the right clinician at the right time. We need to help populations look after themselves in a different way. So kind of more preventative health advice and education, I think, is key. But I remain incredibly hopeful that new government, fresh thinking, new reports means that we're actually really going to look at this sector in a completely different way and work collaboratively to solve some of the problems that have been brewing for a while that we probably should have fixed a little while ago.
Going back to your HR hat on, once upon a time, workforce, how attractive is it now, a primary care setting, for individuals new coming into the arena, retaining such individuals as well? Because we know the cost of living and so on and so forth. Other people are getting, multiple jobs or a second job to support. How has that changed in the last few months at all, or say in the last year?
Yeah, I think the sector's challenging, and I think it's really tricky. As an organisation, my people are my greatest asset, and they're not just words. We have to find ways to enable our people to be their best selves, and you only do that when you're enabling people to work on the things that they love doing. They've got the right time and the tools and the support to do those things. And so for all of my workforce, we really have to have a think about what that means. I like to believe our operating model enables people to do, we talk about clinicians operating at the top of their licence. We talk about wrapping around support and using digital technology to do some of the stuff that they don't need to do. We talk about trying to maximise our appointment time so that doctors aren't necessarily feeling really stretched and really back to back all the time. So they've got enough admin time to do the stuff and do it well. And we talk about the importance of our multidisciplinary teams, our other clinicians, or our really critical reception staff, and making sure that they have really good career progression and development. So I've got multiple examples of new entrants, apprentices coming into the organisation at that kind of reception admin and going up to practice manager or retraining to be a nurse. And so I think nothing is easy. If it was easy, we'd have fixed it all. But actually, there are some real creative things that certainly we're trying to do as an organisation to make it better. And so far, my turnover is very low.
Good.
And I'm filling all my vacancies. So we must be doing something right.
Yeah. And it's good to see the interest levels are certainly out there with, individuals aspiring to be part of, as I mentioned before, such a setting.
It breaks my heart seeing some of the headlines that says, GPs being Uber drivers and can't get a job. Any of those doctors watching and want a job, then they should absolutely let me know. Because,
there we go.
There you go. But yeah, the sector needs some help, and we need to, again, I think that's why it's being collaborative in our solutions. We need to come together, and it doesn't matter which provider, we're all in it for the same outcome, which is ultimately to deliver great primary care.
Interesting. So just talking about different providers as well, do you engage with them? Do you sort of swap stories, as it were, or, challenges that you're all facing and how you could potentially, should I say, work together? Possibly not, but learn from each other.
Yeah. I think ultimately that's the great thing about health and care, right? You're filled with people that actually like people, are kind to people. And so, yeah, we get together. Lots of independent providers get together. We work with our ICB colleagues. We have various meetings in our localities to see how we can help, not just within primary care, but also the broader kind of primary into community care. So it's super important that we all work together. And so, yeah, we try to promote that. And, you know, any time that we get to talk about how we can make things better, we'll definitely be around the table.
And that's always what we want to hear, collaboration. But to sum up, what would you say you most like about your role? And dare I say it, what you least like about your role? Because there's always that as well. We don't speak about it too much in that sense. But yes, do share.
So what do I love? I love the organisation I'm leading. I believe any leadership role is a real privilege, and I definitely feel that in this role. I love the opportunity to get out and speak to my teams and find out what's not working well for them, find out what they want to do better, and then having the authority to go and make those things happen and change those things. There's a real sense of, you know, responsibility, but the ability to get things done at this level. So I think that's probably the greatest thing. And probably the reverse of that is, at the heart, I've always been an operator, and I love getting in the room. I love problem solving. I love driving things with pace. And sometimes as the chief exec, if you're in the room, you slow down the rest of everybody else's conversations because they're waiting for you to speak, or they want to understand what your view is. And so actually I'm having to learn to get out of the room sometimes and making the right call on whether I should be there or whether actually it's time for other people to kind of take the lead on something. So that's inherently, I'm nosy, inherently I want to be in everything.
Good. Yeah.
And so, yeah, just learning to step back and let my phenomenal people do the things that they're really great at.
I like the way you say the reverse of it, where I said least like, which is a nice
the
wording.
people person in me.
It is. Again, that's come out.
No weaknesses.
So it shines for sure. Any sort of hints and tips to other aspiring CEOs, irrespective of, you know, which former board role that they have come from?
I always think you're never going to feel ready for the next move at any level, actually. Whenever you're kind of getting ready to kind of move and step into a slightly different role, I think, you know, just grab the opportunities that come, you know that it's okay to be vulnerable as a leader, to know that you don't have to know everything, but mainly focus on surrounding yourself with great people, because, you know, an organisation, I've got 1,500 of them. And so 1,500 great people mean that you can make great things happen. So don't think you're on your own, I think would be what I would say.
And that's a nice way to end it, really, saying you're not on your own, because I think a lot of people at the top feel isolated.
Yeah.
You know, who do they lean on? The chair, the board, but all eyes are at you of, you know, what's the next strategy? What's the next direction of travel? Is there going to be a restructure? Is there going to be another change? And again, that always happens also when a new CEO goes into spot. The workforce automatically think, what are the changes going to be? So I think that's a good way of putting it as well. Samantha, thank you so much.
Thank you.
I really appreciated your time today.
It's been great.
Very
Thank
grateful
you so
to you.
much.
Thank you.